There's a bunch of programs that have started to prevent ACL injuries. Dr. DeFranco on his website actually had a couple of programs he discussed. Can you talk about some things you could do to potentially reduce the number of ACL injuries in athletes?
Yeah, a lot of the injuries in the research have been shown to come from a lack of proprioception. Proprioception is the ability to know where you are in space. So if we can train kids with balance training, perturbation training, working on their biomechanics, even simple things like landing, what often happens is in females, they land with their knees coming in together, and that predisposes them to a lot of injuries based on that valgus force, that force of driving the knees in. So we can teach them to land properly, things like that, as well as the proprioceptive side, where we can teach them to have quicker response times and be able to get out of the way of a potential injury a lot faster.
That's why women athletes potentially have 4 to 5 times the chance of having ACL injury?
Absolutely. It's a couple things. Men generally have a larger number by quantity because of the larger numbers of participants, but women have more per exposure. So they're more likely, and the research points to a couple of different factors, including things like just the shape of the hips again, the intertrochanteric groove, so things inside the knee that can potentially cause that ACL to get trapped a little bit, and it could even, they've even done studies correlating it to the menstrual cycle, which men obviously don't have to deal with.